Hi, hello, assalamualaikum. My name is Shaz and this is Farah. We're both from Mental Health and You and WeCare a Life Health Center. We're both clinical psychologists.
Yes, and today this is a part of our COVID-19 series where we're gonna talk about things related to COVID-19 and mental health. So for today's topic is managing mental health in general.
Alright, so as we all know, the coronavirus is a pandemic.
Right now, so it's really hard on everyone, right,
Yes,
Chaz?
it is very difficult on a lot of people, and it's not just those who have anxiety or depression, but it is in general to a lot of people, and it's affecting a lot of people's mental health.
And when you say about this, one of the common emotion that everybody is feeling is grief. And you might wonder, why grief?
Why grief? In general, it's because I guess it's because now we have
Lost a lot of things.
Yeah, lost a lot of things.
Mm-hmm.
This in general would mean that we have a loss of routine. We have a lot of uncertainties. We have a fears of the unknown.
Our perception that we're all healthy, we're all good, we're safe. I think it's actually being
It's a loss right now.
It's being
Basically, everybody is uncertain about how they are.
What's going to happen.
And what's going to happen. So, generally, it is a lot of grief and also a lot of anxiety that people actually feel. Okay, and it's pretty normal. We got to tell you that if you are feeling anxious right now and you do not know whether it's normal, it is very normal, right?
Yeah, it is normal because
even
it is
we
something
also
hard.
feel anxious,
Yeah.
and we gotta admit it. Even we are feeling anxiety, and we're also feeling a bit afraid about what's going to happen next. But in general, we are gonna also share with you the tips that we use to help ourselves, right?
To help ourselves to actually get through this difficult time. So I think number one, I'll start. Yeah, Shaz. Number one is make sure your basic needs are met. So when we say basic need, we talk about sleep, eat, staying hydrated, and exercise. So good sleep, not oversleeping, eating regularly, not overeating, and of course exercise and make yourself hydrated because it helps you to be able to think rationally. When you have the lack of sleep, or you eat too much, or you don't eat enough, and you don't stay physically healthy, then it's difficult to actually think, make decisions, rationalize. Your ability to actually stay longer, be calmer is actually affected because you're not well.
Right? Yeah. And the whole goal here right now is to actually stay as healthy as possible, and we
considering
the circumstances, it's very hard for us to go out and do exercise. Those people who exercise outside, but it doesn't mean that we cannot do it at home, right?
You just have to adjust certain things. Yeah.
And so number 2, what do we do? I would say limit time spent following the coronavirus bulletin. Okay, this would mean that try to not look at what's going on all the time. Because of course it will create a lot more of anxiety. And it will make us feel a lot worse, and it will also make us feel like as if we're out of control.
And you may be exposed to those fake news as well, which probably make you feel even worse.
Yes, and everybody is updating something on social media right now, and that is our connection to the world right now. And of course we kind of tend to end up looking at it. I don't disagree in that part that we end up looking at our phones most of the time. And what I would probably say is to actually look out for sources that are reliable. For example, for
official,
in Malaysia that would be KKM, and that will give you accurate details about what's going on.
Okay, so that's number 2. Number 3 is develop a plan on how you want to handle this. So when we say develop a plan, you think about, what am I going to do for the next, for this time, this period of time where there's a lot of infection going around. What do I do? How can I stay safe? How can I, make my family, be safe? What are the precautions we need to do? What do we need to plan? So talking about how you how you want to deal with this is actually going to give you some amount of control, right?
Right. That is true. So I would say we just keep it to a day-to-day basis. Plan your day. What you're gonna do. It gives us a sense of control, and that would reduce some kind of anxiety that you are having.
And it also help you protect it.
Yes, that's right. Okay. So number 4 is make sure you're not feeling lonely. Okay, when they tell us, social distancing needs to be done, it does not mean that we cannot be in touch with our family and friends. Yeah, they say social distancing, but we are in this technology era where we know we can actually just video call people, we can WhatsApp people, we can actually still stay connected, and
we can also take the phone and just call normally, like old
call
school.
normally, nowadays. Yes. And that is about not making sure that you're not feeling lonely, because
that will
of
make
course,
you even worse.
Yes, it make you feel very, very
Because
bad.
remember, you're not the only one that's experiencing this. Everybody else is experiencing it,
Yeah.
because it's such in a global scale. Okay.
Yeah, so sharing your worries with your friends, that is a good way to actually help yourself.
Yeah. So I think there were 4 top tips that we give, but if you think that it's not really enough and you need more help, I would say right now we are offering e-therapy services, which is you can contact us and set up an appointment with us to actually have therapy sessions.
Yes, so that's right. E-therapy services are available right now.
Yeah. Okay, so I think that's all from us today. We have more topics related to COVID-19 series. So yeah, stay tuned.
All right.
Bye.
Bye.